I'm Dan Sostek. Welcome to our segment, Ask the Doctor. Tonight we have a special guest, Dr. Joanne Linvesky of Penn Radnor Hospital. We're going to be discussing colorectal cancer. So, Joanne, what are the important functions of the colon?
The colon's main function is to absorb water. It also serves to move feces along and to act as a storage area so that we don't have to go to the bathroom all day long.
Very interesting. How does colon cancer or colorectal cancer start or develop?
We believe that colon cancers start from things called polyps. Polyps are growths of the colon that are benign, but they develop mutations, and these mutations turn into cancer, which are cells that are dividing at an abnormal rate.
How do you diagnose or discover colorectal cancer?
Colon cancer is usually discovered via a colonoscopy. That's a test where we take a tube, it's about as big as my finger, it goes into the colon and it has a little camera on it, and we watch the video on a screen in front of us, and the camera goes all the way around the entire colon, and we look at the walls and we find colon. That's the main way we find colon cancer. Sometimes they can be found on a test called a barium enema, where we insert barium and take x-rays, and sometimes on a CAT scan or MRI, but the main way is through a colonoscopy.
What are some warning signs of colon cancer?
Warning signs: colon cancer can be completely silent and found on a routine colonoscopy, but also the main warning signs would be bleeding from your rectum when you go to the bathroom, abdominal pain, a change in the way you move your bowels, either slow or going very infrequently or too fast. Unintentional weight loss is another warning sign.
How fatal is colon cancer?
If colon cancer is found early, it's not fatal at all, but in many cases when it's found too late, it can be fatal. So the object is to find it early when it's easily removed and dealt with.
All right, and our last question: what are some risk factors for colorectal cancer, and are any of them preventable?
The main risk factor for colorectal cancer is probably a family history of colon cancer. That means having a first-degree family member. That means mom, dad, brother, sister, or even a child who has colon cancer. And that risk increases with the number of relatives who have colon cancer. Other risk factors for colon cancer are if you've already had polyps yourself. And a third risk factor is having a disease called ulcerative colitis or Crohn's disease, which are inflammatory conditions of the colon.
All right, and so we're done with our questions, so is there anything else you'd like to add?
I thought that I would just show you, well, one thing that you didn't ask me, one way to prevent colon cancer is to have a colonoscopy and remove the polyps before they turn into colon cancer. So I thought I'd show you how we remove these polyps, and this is a video of a polypectomy. I'm going to start it up in a minute. What happened, Dan? Is it going? All right, this is a in a minute. There's water in there. This is a polyp. As you can see, it's an abnormal growth in this. This is normal colon. The colonoscopist is putting out what's a wire snare. It's going around the polyp. He's closing the snare, and he's going to apply electrical current, which is going to cut the polyp off. In a second, there goes the electrical current, and in a minute you're going to see he's going to move the polyp, and all that's left, well, there's the polyp. It's gone. He's going to take it out, and there's just a little white spot which we saw a second ago. He's not going to show it to us. That's probably enough. And it's gone, and in that way we actually can prevent colon cancer, because that polyp's gone. It doesn't pose any harm to the patient whatsoever. So the key is get your colonoscopies, have the polyps removed, prevent colon cancer.
Thank you for your time, Dr. Linvesky. We really appreciate it.